Hello, my name is Nurse Pauline RN. The title of my video today is Fundamentals of Nursing. We are on exam number 8, RN Review NCLEX. Please like, subscribe, and share. We're gonna start talking about nutrition as I had in my previous video, exam number 7. I'm gonna repeat something on nutrition. Patients on parental nutrition going through a central line. If your patient has air embolus, have the patient perform Valsalva maneuver. The purpose of fat emulsion in parental nutrition is to prevent a deficiency of essential fatty acids. Deficiency in essential fatty acids. Fat emulsion in TPNs, parental nutrition, will help control hyperglycemia during periods of stress. Parental nutrition will help with wound healing. We're talking about skin injury. We should be turning and repositioning our patients who are immobile every 2 hours. We should assess them for redness over bony prominency. When obtaining a wound culture to determine the presence of wound infection, specimens should be taken from cleansed wound. Stage 1 ulcer, non-blanchable, redness of intact skin, discoloration, warmth, edema, pain may be present. Stage 2 ulcer, partial thickness skin loss or intact, blister with serosanguineous fluid. Stage 3 ulcer, full thickness skin loss, subcutaneous fat may be visible, may include undermining. Stage 4 ulcer, full thickness tissue loss, muscle bone visible, may include undermining. We're talking about our post-operative patients. Post-operative patients with a closed abdominal wound reporting sudden pop after coughing or sneezing. The nurse should examine the surgical abdominal wound. Examine the sutures to see if the sutures are popped open. You may also see small bowels at the bottom of the surgical wound. What you should do, you should notify your doctor stat and stay with the patient. Never leave this patient. Someone else can call the doctor. Always stay with this patient in case of distress. Cover area with sterile gauze, saline with soaked towels immediately. Stay with the patient. Assess for signs and symptoms of distress. Steps for performing wound irrigation. Check your clinical procedure book. Place waterproof bag near the bed. Fill syringe with irrigation fluid. Attach 19 gauge angio catheter to syringe. Position angiocatheter over wound. Use slow, continuous pressure to irrigate wound. We're talking about ice bags. They are used for muscle sprains, localized hemorrhage or hematoma. Ice bags help to prevent edema formation, controls bleeding, and anesthetize the body part. Skincare measures used to manage fecal and urinary incontinence are frequent position changes every 2 hours, using incontinence cleaner, applying a moisture barrier ointment to skin. A dressing that forms a gel that interacts with wound surface is called hydrocolloid dressing. An abdominal binder used post-operatively, immediately after abdominal surgery, provides support to abdominal tissues when coughing or sneezing or walking, reduces stress to the abdominal incision. Application of warm compresses to ankle muscle sprains relieves edema, improves blood flow to injured part. Removal of devitalized tissue from a wound is called debridement. The 3 important dimensions to measure to determine wound healing is width, length, depth. Braden scale evaluates risk factors that place your patient at risk for skin breakdown. Signs and symptoms of unstageable wound is tissue is dark, hard, adherent to the wound edge. Measures used to reduce skin damage from SHEARS or SHEARING are use transfer devices, example, transfer boards, Hoyer lifts, slide sheets. Have head of bed flat when repositioning your patients. Raise head of bed 30 degrees when patient is positioned in a supine position. We're talking about sensory alterations now. Patients on isolation, interventions to decrease sensory deprivation are teaching activities, example, reading, crossword puzzles provide stimulation. Turning on lights and opening blinds, sitting down, speaking, touching, listening to patients' feelings and patients' perceptions. When teaching interventions to facilitate locations of items for vision impairment patients, use warm lighting. Patients with bilateral hearing loss, keep your arms to your side. Speak directly into patient's ear. Discharge teaching to patients with glaucoma to enable patient to function safely with existing deficits and continue a normal lifestyle includes working with patients and families to identify home modification to create a comfortable and accessible environment. Discharge teaching to families how to ambulate patients at homes. Have patient grip your arm just above elbow and walk at a comfortable pace. Stand next to patient at the top, bottom of the stairs. Ambulating a patient with vision problems and assisting the patient to sit down in a chair. Guide patient's hand to nurse's arm resting above the elbow. Position yourself half step in front of patient. Position patient's hand on back of the chair before sitting. Discharge teaching for patients with diminished tactile sensation. Patients are at risk for injury from temperature extremes. Patient may be able to dress with zippers or pull over. A home care nurse can help patients to be more independent for patients with diminished tactile sensation. Best intervention when communicating with patients with expressive aphasia is use a dry erase board. Interventions to reduce loneliness for vision impairment patients. The nurse will share information about senior transportation services, provide information about local social groups in patients' neighborhoods, consider patient making living arrangements that will put patients closer to families and friends. Priority intervention, patients with bilateral eye trauma, intervention. Placing necessary objects close, such as collites, water pitchers in front of patients to prevent falls caused by reaching over. Patients most likely to experience sensory overload. These patients are in your ICUs whose pain is not controlled. Patient most likely to experience sensory overload. Patients in ICU, pain uncontrolled. Patients with stroke affecting the right hemisphere of the brain will experience inattention, neglect, especially on the left side. These are for stroke affecting the right hemisphere. Inattention and neglect on the left side. Visual spatial alterations such as loss of half of visual field. Assessment and teaching for hearing impairment patients. Demonstrate hearing aid battery replacement. Review methods to check volumes on hearing aid. Discuss the importance of having airwax build up in ear canal removed. For surgical patients, Obesity places patients at risk for ventilatory capacity is reduced. Fatty tissue has a poor blood supply. Physical mobility is often impaired in obese patients postoperatively. Primary reason to include families in preoperative exercising. Primary reason to include families in preoperative teaching is to coach and encourage patients after surgery and at home. Patients in the PACU post-anesthesia recovery unit. Patient is having difficulty breathing. Nurse suspects upper airway obstruction. In the PACU post-operatively, the nurse must position patient on side, face down, neck slightly extended so tongue falls forward. Older adults postoperatively are at risk for respiratory complications. Encourage patient to turn, cough, and deep breathe frequently, every 2 hours. Make sure patient's pain is controlled. Patients postoperatively experience low blood pressure, tachycardia, thready pulse, cool, clammy, pale skin, restlessness. Assess surgical wound for saturated blood. Call the surgeon immediately. Stay with the patient. Do not leave the patient's bedside. Maintain IV fluid infusion. Blood pressure is low. Prepare to give volume replacement when ordered by the doctor. Blood pressure is low. Monitor vital signs every 15 minutes or more until the doctor gets there, until the patient is stabilized. Patient postoperatively is having a very high temperature, maybe 103 degrees, heart rate elevated, maybe 130, respiration elevated, maybe 30. This patient is having jaw muscle rigidity. This patient is having rigidity of limbs. This patient is having rigidity of the abdomen and chest. The patient's temperature is elevated. I said maybe 103, excessive sweating. Check the patient's pulse ox. Pulse ox is low, less than 92%. This is an emergency for this post-op patient. Notify the doctor as soon as possible. Notify the surgeon as soon as possible. Do not leave the bedside. Do not leave the bedside. Monitor vital signs frequently. Stay with the patient. This may be an ICU admission for this patient. This patient is in danger. This patient is having signs and symptoms of malignant hyperthermia. Temp is moving over 103 degrees. Precautions after administering preoperative sediment. Preoperative sedative. Safety precaution. Reinforce patients should stay in bed. Patients should stay on the stretcher. The patient cannot get up and walk to the bathroom by him or herself after taking a sedative. If the patient has to go to the bathroom, the nurse and the tech, if possible, 2 standbys, after ambulate these patients to the bathroom after a preoperative sedative. Preoperatively, before you send the patient down to the OR, they always ask us to have the patient go to the bathroom and empty his or her bladder before you send the patient to surgery. To prevent latex allergy precautions, especially in the OR or in the PACU, post-anesthesia unit, screen patient for food allergy known to have cross-reactivity to latex. Assess if your patient has allergy to latex preoperatively. If patient is a latex allergy patient, there should always be a latex allergy card available at the bedside for the patient. This includes PPE that's allergy free, Foley catheter that's allergy free, gloves that are latex allergy free. If you are not told by the patient that he or she has allergic reaction to allergy and it's a pre-op patient, notify your doctor as soon as possible. Communications with the OR team should be done 24 to 48 hours before surgery if you identify latex allergy. Patients receiving contrast sedation advantage. Contrast sedation has over general anesthesia, is reduction of fear and anxiety, amnesia about procedure. When you're starting your shift, you just got handoff, you're working the day shift, you just got handoff from your night shift. Who do you see first? You have to know that in your exam NCLEX. Who do you see first? You first see your fresh post-op patient. That's the first patients you make rounds on. You first see your patients with PCA, patient-controlled analgesia. Patients with low pulse ox you see first. They will post-operatively, all patients will have a pulse ox machine at the bedside, and if their oxygen go down below 92%, that pulse ox machine is going off. Make sure you run to the room and check your post-op, fresh post-op on PCAs and oxygen machines at the bedside. Your first priority will be your patients with sleep apnea who is still in the morning on a CPAP or even nighttime. First priority for sleep apnea patients who are on CPAP or BiPAP machine. Okay, we're talking about appropriate components of a safe and effective handoff of a post-op patient from PACU. For example, you're working on the day shift, you're expecting your patients coming up from the PACU. Here comes the patient on the stretcher with a nurse, maybe with family members. You're taking handoff for your patients. You will ask the PACU nurse, or she'll tell you, check the vital signs before she leaves the bedside. That's a handoff. Make sure the patient is handed off safely to you. So first is for your vital signs. You will check the kind of anesthesia provided. Was it a general anesthesia? Make sure you know the type of anesthesia. Make sure you know the EBL, estimated blood loss during surgery. Make sure the PACU nurse tell you what is the level of consciousness of this patient. Before you say goodbye to the PACU nurse, make sure you have a thorough handoff. Make sure she's able to answer all your questions. At that time of your handoff, you're supposed to be having an uninterrupted time to review with PACU RN the recent pertinent event and ask questions about your patient. Ask all the questions you can. You ask the PACU nurse, maybe the family did not accompany the PACU nurse coming up on a stretcher with the patient. Ask the PACU nurse, did this patient have family members in the OR waiting? Where is the family? Did the family go home? Did they go out for breakfast? When the family wakes up, the family is gonna ask you. The patient is gonna ask you first, "Where is my mom?" You have to know the location. Do not forget to ask the PACU nurse, "Where is the family?" Always have uninterrupted time to review with the PACU nurse the recent event and ask questions about your patients. Check your vital signs. Make sure they're stable before handoff. Check your oxygen level. Preoperatively, if your patient's temperature is elevated, your WBC, white blood count, is elevated, if your blood pressure is decreased, maybe the heart rate is elevated, notify your surgeon immediately. Surgeon may need to delay this surgery. You have to recheck the WBC count, put in your labs to have a recheck. The doctor needs to investigate the source of a fever before getting antibiotics. Sometimes when the doctor finds out the source of the fever, the doctor will order antibiotics. The surgery may be cancelled, or the doctor may say, give you an order for antibiotics to be administered before the surgery. Maybe the surgery will be delayed until later in the day. But we have to investigate the source of this fever and elevated WBC. Maybe there's presence of some bacteria infection. RN teaching patient how to perform incentives spirometer. Check your clinical procedure book. These post-operative patients, especially those who have abdominal surgery with staples, will have difficulty using an incentive spirometer at first. Teach patients to assume a semi-Fowler or high Fowler 90 degrees position, inhaling slowly while maintaining constant flow through unit until it reaches goal volume, ending with 2 coughs at the end. With an incentive spirometer, the doctor will order 10 breaths on the hour 1 breath every 10 minutes. Interventions necessary for your post-operative patients to prevent venous thrombosis, to prevent blood clots, is your SCD, sequential compression device, pneumatic compression stockings. When ambulating a post-op patient, if the heart rate increases from the baseline, your next action is to ask patient how he or she feels. Determine if there is any discomfort or short of breath, SOB. If there is no discomfort, no shortness of breath, then you can continue your exercise. Please like, subscribe, please share. Have a blessed day. Thank you. Stay tuned for exam 9. Stay blessed. Thank you.